Hi, I am Dr. Srihari Neurosurgeon, Consultant Brain and Spine Surgeon in KIMS Hospital, Kompally. Today's topic is brain tumors and its management. Brain tumors is a common disease. It has got different types of tumors within. Most common tumor is meningioma and glioma. And coming to the complaints of these tumors, many tumors will remain silent for a few months to years. Some tumors present very early, and depending on the complaints we can evaluate the patient. Complaints usually would be in the form of headache, vomiting, fits, weakness of limbs, difficulty in smelling things, difficulty in vision, difficulty in walking around. Investigation for the brain tumor would be a CT scan or the MRI scan, which most of the times will localize where the tumor is, what kind of tumor it is it a surface tumor or tumor within the brain or tumor at the base of the brain or a tumor of the nerves. A tumor of the pituitary gland can also be seen with the MRI scan. After evaluating the patient for brain tumors, if brain tumor is confirmed, the management would be in the form of surgery. Surgery is the craniotomy for the surface tumors and the deep-seated tumors of the brain. For the surface tumors, surgical excision of the tumor is complete, while a tumor within the deep substance of the brain, the excision of the tumor is not complete. Such patients after surgery have to undergo chemotherapy, radiotherapy depending on the histology of the finding, the histology of the tumor. Depending on the site of the brain tumor, surgical approaches to the tumor would be different. If there is a surface tumor, craniotomy is done. If there is a tumor in the pituitary gland, we have to do transnasal, transcranial surgery. If there is a tumor on the back posterior fossa of the brain, the surgery on the back of the head is required. Depending on the location of the tumor, surgical approach is planned. And usually surgical excision will entail a complete excision of the tumor. Sometimes we get the sufficient tissue for the biopsy, and the biopsy report will dictate what to do next in the form of chemotherapy, radiotherapy, and the follow-up. Most of the times brain tumors, if completely excised, carries good prognosis. Some brain tumors need not be completely excised, they are kept under observation in such conditions. Some tumors which are aggressive, even after seemingly complete excision, may not be completely excised. Such kind of patients have to be under routine observation, and if there is a proliferation of the tissue after surgical procedure, such kind of patients are exposed to chemotherapy and radiotherapy. The outcome and the survival of the brain tumor depends on mainly the location of the brain tumor, excision of the surgical excision whether complete or not, and the biopsy of the tumor. Sometimes the biopsy dictates the lifespan of the person. For example, a brain tumor which is very aggressive, which is said to be a grade 4 tumor, will have a lifespan less than 6 months, and a grade 3 tumor which have a lifespan of around 2 to 4 years. Grade 2 tumors has 5 to 10 years. Grade 1 tumors will have a maximum lifespan that is around 10 to 20 years. That depends on the biopsy report of the brain tumors. Not all patients are fortunate enough to have good outcomes. There are multiple factors in deciding the kind of outcome the patient gets. Brain tumor, when picked up early, gives better prognosis. When picked up late, results are very poor. Therefore, awareness about brain tumors and the investigations when prompted by the doctor should be done correctly, so that the disease can be picked up early. Early pickup of the brain tumor gives better results, better outcome, and the lifespan of the patient will be better. If the brain tumors are detected late, that results in delay in treatment and delay in the outcome, and the outcome may not be optimal in that condition. Beware, any patient who has got headache, vomiting, fits can have a brain tumor, and such patients have to be investigated for early picking up of the disease, so that the treatment is seamless and smooth, hoping for the better future, better outcome. Thank you.